The program is called Home Builders, and it's a model that's been used across the country for years.
It is the most well-known evidence-based program specifically focused on keeping kids out of foster care and at home with their families in the United States.
And thanks to a new contract with the North Carolina Department of Health and Human Services, the program will be expanded to 11 counties in the state. Crossnore's Senior Director of Prevention Services, Angela Squire, says the goal of the program is to provide support within the home, rather than removing the child.
So we have practitioners that work with families about 10 hours a week in the homes. They're there 3 to 5 times a week, and they're there to address any of the risk factors that are present that are considerations for the kids going into foster care.
Home Builders only works with families who are most at risk, meaning the Department of Social Services is set to remove children within 24 hours. Once they've been referred, the team goes in and identifies the risk factors. They then work to connect families to the resources they need to address them.
If it's around, truancy, we're going to work with the parents to try to get the kids to school. If it's around parental substance use, we make sure that the parents are in their substance use treatment program. If there's concern about the condition of the home, we've got staff that go in and help clean out the homes and make it more habitable for the children.
According to Squire, the program has had a 96% success rate, meaning most of the children they've worked with have avoided being placed in foster care, something she says can be an extremely traumatic experience.
They're not just, experiencing the trauma and then being removed from their home. They have complex trauma. They're removed from their siblings a lot of times. They're removed from their schools, their neighborhoods.
Squire says that complex trauma can cause long-term problems for children. That's why addressing it before it happens is so important.
The prevention work is really where it's at. The more we can do on the front end to prevent ongoing and complex trauma, the better outcomes we're going to get generationally.
With the new contract, NCDHHS estimates that Crossnore will help serve 170 families each year. In the Triad, I'm Casey Zanowick, ABC 45 News, standing up for you.